Hello Psych 101, my name is Madison, and today I'll be talking to you guys about panic attacks. So what is a panic attack? A panic attack can most easily be described as an intense feeling of panic or fear that is triggered by, it can be triggered by an event, it can be triggered by something or somewhere that you've had a traumatic experience at. It can be triggered just out of pure stress as well. It's generally going to be associated with anxiety and panic disorders such as generalized anxiety, OCD, PTSD, anything of that sort. How common are panic attacks? So, panic attacks affect around 11% of Americans yearly. They can affect any age of person. Most commonly, we're going to kind of see a lot of the people affected around teenage years into young adults. However, obviously young children can have a panic attack. It really just depends on their own mental health history, or if they're predisposed due to their childhood or any other maybe genetic traits. Women are 2 times more likely to experience a panic attack. There's no real explanation behind this that I could find. Women are more prone to it, as it would appear. Panic attacks are thought to be caused by traumatic experiences, genetics, mental health issues, and substance problems. These are like the 4 key elements that people think are what causes panic attacks. So the diagnosis process. So one of the first things is a full body exam may be used to evaluate the heart and thyroid. This is mainly going to be because the thyroid has actually shown a lot of connections to that of anxiety-based mental health issues. So this would obviously fall into that. And then the heart is going to be evaluated because, panic attacks, one of the main symptoms has to do with the heart. So they're going to do this to see, is there strain going in on it? Like, what's happening in that area? Most commonly, psychological examinations are used to spot symptoms associated with panic attacks. So these are going to be like questionnaires, like you explaining what you're feeling to the doctor, or most likely them asking you series of questions, stuff around that. So to actually be diagnosed as a panic disorder, not for having panic attacks necessarily, you have to meet some pretty strict criteria. So it's going to involve having sudden panic attacks without a clear trigger, panic attacks that are not caused by substance usage, and no history of other mental health issues that would be a cause. Because although you can definitely have panic attacks, with any of these reasonings, it doesn't mean you have a panic disorder, which is what they would be diagnosing you with. So symptoms of panic attacks, they have a very large range of symptoms, if we're being honest. Typically those who are experiencing a panic attack are going to have 4 accompanying symptoms. There is another classification for panic attacks, and they're considered more minor panic attacks in which you don't have the 4 symptoms. Instead, you're going to have, 1 or 2, but it's just kind of more of a mild panic attack. The most common symptoms are going to be the feeling of not being in control, which unfortunately has a lot to do with dissociation. You're going to feel like you don't have control over things you're doing, you don't really control your life, that kind of thing. A fear of death. This is going to play more into people who, when they're having a panic attack, they think they're dying, which obviously makes the panic attack 10 times worse. Then we have racing heart, chills, breathing problems. With the breathing problems, it's going to be people aren't thinking they're able to breathe, people are thinking they're going to stop breathing. chest pain, nausea, and some stomach pains. So many people who experience panic attacks, unfortunately, can have even more panic attacks when they become fearful of having another one. So this would be an instance of somebody having one, and because they were so freaked out and, fearful of having another one, they induce themselves into another one, which is awful. So, some common misconceptions about panic attacks. I went ahead and chose 2 of the best that I personally thought I should talk about. If I have a panic attack, I have a panic disorder. So, this is just not true. There are many other mental health issues and physical issues that can bring on a panic attack. Simply being, super stressed about something can also be the cause of a panic attack. Panic attacks aren't only associated with mental health issues, although a lot of mental health issues have panic attacks as a symptom. You don't have to have a mental health issue to experience a panic attack at some point in your life. So, no, if you have a panic attack, it doesn't mean you have a panic disorder. And then the second misconception was panic attacks are just people overreacting to stress. So, this is wrong. Panic attacks are not controllable, so a person can't overreact to something they have no control over. Chemically, your brain is overreacting to a situation. That is scientifically true, but you don't have any control over what chemicals your brain is sending out. That's not something you have control over. So it's not somebody overreacting, it's their brain overreacting. But again, they can't just fix that. So some treatments for panic attacks. We're going to start with psychotherapy. The most common one used is going to be cognitive behavioral therapy. It helps those who suffer with panic attacks by teaching them to react differently to the feelings they have while having a panic attack. So this would be when they feel the feelings coming on, instead of, just fueling the fire and adding some more, stress and panic to it. They're going to think of different ways of thinking so that they don't make it happen. This process actually has the highest success rate for treating panic attacks. And, it's also not one that's going to take, for most people, a whole lot of time to actually develop. It can take a few years, but compared to some other treatments, cognitive behavioral therapy seems to be one of the best. So there's that. And then medication, many times SSRIs and SNRIs are going to be used in the treatment of panic attacks. These are also known as antidepressants, so these are also used to treat depression. Medication has been proven to be about 75% effective, and that's in the higher rating categories. Really, it ranges anywhere from 40 to 75. So really, medication seems to depend on the person, and, obviously it's going to work for some people, but it's not for others. And then finally, meditation. This technique, although less science involved, it's actually proven to be very useful in helping to prevent oncoming panic attacks and to prevent future ones. There's a lot of research still going into this treatment category, but for a lot of people it has shown, significant usefulness in helping people subside, these panic attacks. So then finally, I'm kind of just going to go ahead and play a video. I personally think this is a good wrap-up of everything I've talked about with panic attacks. And it might even, help explain some things I maybe didn't explain to the fullest extent.
The body becomes its own corset. Past, present, and future exist as a single force. A swing without gravity soars to a terrifying height. The outlines of people and things dissolve. Countless poets and writers have tried to put words to the experience of a panic attack. A sensation so overwhelming, many people mistake it for a heart attack, stroke, or other life-threatening crisis. Though panic attacks don't cause long-term physical harm, afterwards, the fear of another attack can limit someone's daily life and cause more panic attacks. Studies suggest that almost a third of us will experience at least one panic attack in our lives, and whether it's your first, your 100th, or you're witnessing someone else go through one, no one wants to repeat the experience. Even learning about them can be uncomfortable, but it's necessary, because the first step to preventing panic attacks is understanding them. At its core, a panic attack is an overreaction to the body's normal physiological response to the perception of danger. This response starts with the amygdala, the brain region involved in processing fear. When the amygdala perceives danger, it stimulates the sympathetic nervous system, which triggers the release of adrenaline. Adrenaline prompts an increase in the heart and breathing rate to get blood and oxygen to the muscles of the arms and legs. This also sends oxygen to the brain, making it more alert and responsive. During a panic attack, this response is exaggerated well past what would be useful in a dangerous situation, causing a racing heart, heavy breathing, or hyperventilation. The changes to blood flow cause lightheadedness and numbness in the hands and feet. A panic attack usually peaks within 10 minutes. Then, the prefrontal cortex takes over from the amygdala and stimulates the parasympathetic nervous system. This triggers the release of a hormone called acetylcholine that decreases the heart rate and gradually winds down the panic attack. In a panic attack, the body's perception of danger is enough to trigger the response we would have to a real threat, and then some. We don't know for sure why this happens, but sometimes cues in the environment that remind us of traumatic past experience can trigger a panic attack. Panic attacks can be part of anxiety disorders like PTSD, social anxiety disorder, OCD, and generalized anxiety disorder. Recurring panic attacks, frequent worry about new attacks, and behavioral changes to avoid panic attacks can lead to a diagnosis of a panic disorder. The two main treatments for panic disorder are antidepressant medication and cognitive behavioral therapy, or CBT. Both have about a 40% response rate, though someone who responds to one may not respond to the other. However, antidepressant medications carry some side effects, and 50% of people relapse when they stop taking them. CBT, meanwhile, is more lasting, with only a 20% relapse rate. The goal of CBT treatment for panic disorder is to help people learn and practice concrete tools to exert physical and, in turn, mental control over the sensations and thoughts associated with a panic attack. CBT begins with an explanation of the physiological causes of a panic attack, followed by breath and muscle exercises designed to help people consciously control breathing patterns. Next comes cognitive restructuring, which involves identifying and changing the thoughts that are common during attacks, such as believing you'll stop breathing, have a heart attack, or die, and replacing them with more accurate thoughts. The next stage of treatment is exposure to the bodily sensations and situations that typically trigger a panic attack. The goal is to change the belief through experience that these sensations and situations are dangerous. Even after CBT, taking these steps isn't easy in the grip of an attack. But with practice, these tools can both prevent and de-escalate attacks, and ultimately reduce the hold of panic on a person's life. Outside formal therapy, many panickers find relief from the same beliefs CBT aims to instill: that fear can't hurt you, but holding on to it will escalate panic. Even if you've never had a panic attack, understanding them will help you identify one in yourself or someone else, and recognizing them is the first step in preventing them. Panic attacks.
So that video was kind of just, again, like I said, a good rundown. I think it explained the use of cognitive behavioral therapy extremely well, and I just thought it was pretty informative in how it explained some stuff. So here are just some of my sources that I used, and that concludes my presentation. So thank you for watching, and I hope you learned something new today.